Whenever we have a compromise in the position of the lower incisors, we have to avoid that during alignment they are proclined and they create a periodontal problem because of this proclination, which is taking the root out of the bone. If we take a look at this case, we see that tooth 41 is already having a tendency to recession. We can see this problem here, and we want to avoid proclination during the expansion and the leveling and aligning of the arches. In this sense, what we can do is perform and plan the treatment exactly as we would do with brackets and wires. First of all, as you can see, we expand the posterior segment. We ask the CAD designer not to move this anterior segment from 3 to 3 because first we want to create some space by transversal development. Depending on the amount of expansion we can make, we can decide. After that, we can perform some IPR and start distalizing canines at the same time as we are aligning anterior teeth. In this sense, take a look, we're doing some proclination. I mean, this is a round tripping movement, but we need good contact points before we do the IPR in between them. And we have the IPR, when we have the stripping done, we can retrude them. This is a non-desired movement, but this is the same approach we would have with fixed appliances. First, we need to expand, then get use of the space, use the space that we have distal to the canines to align them. And when the contact points in between the lower incisors is okay, we perform the IPR, we do it in the clinic, and then we retrude. This is a round tripping, but incisors will only be procline during a short amount of time. It shouldn't be a problem for the periodontal status of the patient because we have reduced the time these teeth are proclined. And after that, we can retrocline and end up in a situation like this in which the incisor, which is having a problem, has been retroclined, and we added some extra lingual root torque to this incisor. So we're pretty sure that the movement of tooth 41 is taking 4.6 degrees to lingual, and it is okay and ready to approve applying common sense to aligner biomechanics.